Hello everybody and welcome back to the COVID Camper. This is Dr. John Blanchard from Salta Direct Primary Care, and today is April 20th. It's the 27th day in the camper, and a lot of the questions that we're getting in the office is around antibody testing. You're going to hear a lot about antibody testing in the news. This is a test that's increasingly available in your doctor's office, and one of the things that you really want to try to understand is how accurate the test is. There are a lot of tests that are being imported from China and other places that don't have the sensitivity and the specificity to be a reliable test. And what that means is the test accurate? Is there a high false positive rate or a high false negative rate? Meaning that if you have antibodies, it doesn't show up in the test, and so that would be a false negative rate. Or if you have antibodies, but you really on the test, but you really don't have the antibodies, that would be a false positive rate. You want to ask your doctor how accurate the test is, but also recognize that these tests have not been approved by the FDA. They're being approved on an emergency basis to be used, but they may not give you the accurate results that you hope for. The other thing that we need to understand is that we don't know at this point if the antibodies confer an immunity, and meaning it's possible that you could have antibodies and still get infected. We don't know for sure whether the antibodies are going to protect people or not. So there are limitations to this test. If your doctor's offering the test, you want to find out was it manufactured in China? There's a lot of tests being imported from China and other places that we don't think are necessarily accurate. You want to ask how accurate the test is and how reliable it is. There are tests that are being produced in the United States, and they're not FDA approved yet, but they are being used in doctors' offices that may have a little better reliability. I think it's important that we recognize that there's some limitations here. The other thing is that any test is only as good as the population that it's being tested on. The rate of the illness in the population that's being tested. So if we use this antibody test to check for antibodies in people that are just asymptomatic, they've never had any symptoms, the likelihood of the disease in that population is going to be lower, and it's going to reduce the positive predictive value and the negative predictive value of the test. This is kind of a hard concept to understand, but the point is that the antibody testing is best used at this point in people that have had symptoms, so that it's being used on a population of people that have a higher likelihood of having the condition in that population, and it makes the test more reliable. So you shouldn't go out and rush to check your antibodies if you haven't had symptoms, because it may make the test less reliable, and the test already might not have a very high reliability rate. So it's something you want to talk to your doctor about and really understand. One of the positive things that I hope that comes out of this is the mindfulness that I hope people begin to pay more attention to in managing their stress and anxiousness. And we've talked about how we can fall into thought distortions, and there are many thought distortions that we're covering in these videos. We've covered black and white thinking, personalization, should statements, catastrophizing, magnifying, and today I want to talk about minimizing. So sometimes people, a positive thing will happen in their lives and they will minimize it. So we tend to think about the things that are put us at risk or that cause anxiousness, but we tend to not notice or minimize the things that are positive in our lives. So an example might be that a person gets a raise and they say to themselves, well, the raise should have been bigger and I'm not that good at my job. If I was better at my job, then I would have gotten a bigger raise, instead of just seeing it as a positive thing in their lives. So minimizing is a thought distortion that can drive more anxiety, and we need to catch ourselves in those thought distortions and then stop ourselves and think about it in a true and accurate way. One of the ways that direct primary care works for me is that I'm able to partner with my patients to obtain optimal health in their lives. If you think about our lives, we want to live a long and happy life, and in order to do that, we need our health. And if we don't have our health, it's really hard to achieve all the things that we want to achieve in life, experience all the things that we want to experience in life. And I think even after age 50, a lot of times people begin thinking about, maybe prioritizing their health a little bit higher on the priority list. They may be further down along in their careers, or their children are getting older, and they recognize that, boy, I've worked hard all my life, and I need to maintain my health into my older age so that I can continue to achieve the things that I want to achieve in my life and experience the things that I want to experience in my life, whether it's grandchildren or traveling or continuing to work in a career or maybe a second career. All of those things require us to be healthy. And a lot of times in our 20s and our 30s and our 40s, we tend to put ourselves down on the priority list. And so direct primary care allows people to invest in partnering with someone, a health professional, so that they can work together to achieve optimal health in life. So again, to achieve that optimal health, and we don't want to have a long history of declining health over decades in our later years. We want to be healthy and fit into our older years, and then pass away without having a long and prolonged period of time when we're not able to do the things that we want to do because of our health failing. So I really like that idea of partnering with our patients to achieve optimal health in their lives. And if you want to look into how direct primary care can work for you, see if Salta Direct Primary Care can work for you, check us out on facebook.com/Salta of Clarkston or facebook.com/Salta of Troy, or you can reach Kyle at 248-922-3076. Be safe out there. Love each other. It looks like we may be having the quarantine lifted here in May, and hopefully we can get back out there and start the economy again. We'll have to see what the governor decides on that. Thanks again for watching, and we'll see you again later in this week.